Welcome, everybody. We are glad that you're here. Um, the title of this webinar is about state agency collaboration to serve farm workers, specifically in the state of Michigan. Before we get into it, though, I want to give a little bit of background about who we are, the National Center for Farmworker Health. So we're a nonprofit organization. We're based in Buda, Texas, but we have staff who are around the country. A lot of the work that we do is with federally qualified health centers, and I know that a lot of people in the audience today are from migrant health centers or other kind of health center organizations. So hello and salute to you all. But we do a lot of different work. We do health education material development. We do data and research related to farm worker and farm worker demographics and farm worker families, and other sorts of training and technical assistance activities. And also what we do, or what we've done more of over the last few years, is working with state government agencies, specifically health departments at the state level and even at the county or municipal level. We've been working more with those really since the pandemic, trying to organize when COVID required so much collaboration and communication between government agencies and community-based organizations. And so that'll be the focus of today's webinar, like we talked about, those state government agencies. We want to give a little shout out to a campaign that NCFH runs. This is the Ag Worker Access Campaign. This is a national campaign to try to increase the number of farm workers who go to migrant health centers to receive services. So if you all are from, if there's anybody from a migrant health center in the audience who wants to learn more about this, please email me after this and I can put you in touch with my colleagues who run this. It's a great program. Some of you are probably already familiar with it, but okay. So I want to introduce these great people from the great state of Michigan. The speakers today are Ruby Berumen, Joe Estrada Guerra, Dale Freeman, and Steve Wagstaff. And you all can see the different agencies that they're from, but I'll read a bio for each of these people now. And my name is Matt Solberg. I'm a program coordinator here at NCFH, and I'm excited to be the moderator today to introduce all these speakers and to moderate this discussion, because I've seen, and some of my colleagues have seen firsthand, the great work that these government servants do trying to reach farm workers and provide them with services in Michigan. So I think hopefully we can all learn something from their model. So to start off, we have Joe Estrada Guerra. She is a department analyst with the State of Michigan Department of Health and Human Services in the Farm Worker Outreach Services Division. Joe was born in Texas, but she was raised in West Michigan, and she still lives there today. And she's the third child out of 5 who was born to migrant farm workers, and she moved to Michigan shortly after she was born. Joe was recruited by the state of Michigan in June of 2008, and she's worked in a bunch of different positions for the state government, but her passion has always been working with those with similar backgrounds to hers, which is farm workers and farm worker families. And Joe's favorite quote is from Cesar Chavez, and she always keeps this in mind. The quote goes, "We cannot seek achievement for ourselves and forget about progress and prosperity for our community. Our ambitions must be broad enough to include the aspirations and needs of others for their sakes and for our own." The next speaker today will be Ruby Berumen. She's from the Department of Labor and Economic Opportunity. Ruby's worked with the state of Michigan Employment Services for 10 years, and she was a monitor advocate system outreach worker for 6 years prior to accepting the role of department supervisor, where she now supervises a team of 8 outreach workers, all under the monitor advocate office of Michigan. Ruby has a bachelor's degree in sociology and an associate's degree in early childhood education. She loves plants and flowers, and her motto is "Si se puede." Now we have Dale Freeman. Since 2014, he's been the director of the Migrant Affairs Division for the Department of Health and Human Services. And he's been responsible for the department's migrant seasonal farm worker programs of all sorts. He's held a variety of posts for the department in his 36-year career, including beginning as a migrant assistant payments worker. Dale received a Bachelor of Arts degree in International Relations from Michigan State University, and he also holds a Master of Social Work degree from Grand Valley State University, two great schools in Michigan. And last but not least, we have Steve Wagstaff, who is the Migrant Labor Housing Inspector for the Department of Agriculture and Rural Development. And he served in this capacity for more than 10 years, ensuring clean and safe housing for farm workers through inspection, plan review, complaint responses, and enforcement. Steve holds both a Master of Science and a Bachelor of Science degrees in crop and soil sciences from Michigan State University. And his experience includes environmental health, safety, building inspections for state government, and other things. And he lives with his wife and young daughter in West Michigan. So we have these speakers who are from the three different government agencies: the Department of Agriculture and Rural Development, the Department of Health and Human Services, and the Department of Labor and Economic Opportunity. And so the learning objectives for today are to understand how these agencies collaborate, the model that exists that's kind of unique to the state of Michigan to serve farm workers. The next objective is to outline some strategies. This will happen in the discussion section, to outline strategies for how other states can implement this model or can take tips or things from how these people communicate. And then lastly, to identify some examples of the connection between farm worker housing and farm worker health. So before we start the presentation, though, we want to ask you all, the audience, a poll question. So Lisa or Chelsea, I think, will be releasing that poll question. Do you know how many state government agencies do farm worker outreach in your state? And we'll give everybody about 30 seconds to answer this. And I wish we could ask everybody what states people are from, but again, you can feel free to share in the chat what states you all are coming from. But okay, we can go ahead and close this poll down and see what the responses are. So I'm not sure if people can see my screen or not, but 33% of all respondents said that they don't know. Another 34% said 3 or more. And then a quarter of you all said that 2 agencies do outreach in your state, and 9% said 1. So surprisingly, nobody said 0 agencies do farm worker outreach in their state, which is good. But also, 33% of people don't exactly know. And that's to be expected because in some states, there's so much overlap, or some roles aren't clearly defined. So it's good to get this sense of what people know. And with that, I will pass it to Joe to start us off to talk about the Department of Health and Human Services.
Very good. Thank you so much, Matt. And I just would like to say that I am honored to be here today to share some information regarding our state, our wonderful state of Michigan, and as also, information regarding the Department of Health and Human Services, the Farm Worker Outreach Services Division. So thank you all for allowing us this opportunity. So the Michigan Department of Health and Human Services Farm Worker Outreach Services Division is the lead state agency responsible for the delivery of public benefits and services that meet the economic and cultural needs of migrant and seasonal farm workers that come to Michigan. Some of the assistance programs that we have include the food, medical, emergency, childcare, cash, and state emergency assistance. When the need is outside of our scope of assistance, we seek alternative solutions via referral to partners. This slide shows just a breakdown of the farm worker outreach staff that we have employed by our department. We have 48 migrant program staff located in 11 local offices, which serve a total of 49 counties. The breakdown is 33 migrant program specialists. We have 7 migrant phys specialists. We have 4 general office assistants and 4 migrant program supervisors. And as I said, the outreach and services are provided to migrant and seasonal agricultural workers in 49 counties, and we provide them with public benefits and referrals. So to talk a little about the impact that our department has on individuals, in 2022, we estimate we had about almost 6,000 cases of assistance. And when I talk about cases of assistance, I'm referring to the food assistance, childcare, medical assistance, etc. That totals to about 94,167 migrant and seasonal farm workers and their dependents served by the department in 2022. We are constantly doing outreach events and outreaching to migrant and seasonal farm workers throughout the state of Michigan. Just an example of a recent outreach event was the Migrant Child Task Force. We actually have 4 different child task force events that happen in each year. The most recent was in Oceana County on July 25th. Farm worker families were visited during the day and in the evening hours. And during this time, we were visiting children and connecting with individuals, adults, single workers. But in addition to all these things and providing them with goodies, we connected them with additional services. We had individuals that needed to apply for, benefits. We had individuals that were in, need of assistance to contact Social Security Administration, childcare, and also, inquiries on the medical transportation part of our program. So a lot of great things happening in the state of Michigan. Thank you.
Thank you, Joe. We'll get into some more detailed. I know I have some questions about that specific event afterwards, but we'll pass it on to Ruby now to talk about her work.
Thank you, Matt. Good afternoon, everyone, and thank you for joining us today. I will be sharing some information on migrant and seasonal farm worker monitor advocate system here in Michigan. So our primary responsibility as it comes to farm workers, it's for our monitor advocate system outreach staff to visit MSFWs and their families at their living, working, and gathering areas, and that is to provide employment and training services information, on-site career counseling, education about employment rights, receive complaints, also information on other organizations serving MSFWs in the area, as well as coordinating and facilitating any referrals that they may need. And after doing their presentation, urging our MSFWs to visit their nearest Mission Works one-stop service center to obtain the full range of employment and training opportunities. So something relevant about our department and our team and the work that they do is that the services that our department provides, those are services that are federally mandated and also written into the Wagner-Pfizer Act. We have equity ratio indicators as well as minimum service level indicators that our state has to meet annually. And our team, they all come from MSFW backgrounds. They are Spanish bilingual, which is a language spoken by the majority of our MSFWs in the state. And the work that they do involves working flexible hours, weekends, and also some holidays to serve MSFWs who commonly are not able to visit their Mission Works offices during normal intake hours. So we have 16 monitor advocate system outreach staff in the state, and we cover all 10 regions here in the state of Michigan. In Michigan, there are about approximately 70 Mission Works office centers in the state, with 11 of them identified as MSFW significant. And what that means is that 10% of the customers registered are MSFWs, farm workers. So overall, the AES unit makes Michigan Works one-stop services accessible to MSFWs by providing outreach services where they live, work, and gather. And the way we are structured here in our Agriculture Employment Services unit, we have a program manager, and then we have 2 departmental supervisors, and then the 16 monitor advocate system outreach workers. Out of the 16, we have 9 that are permanent year-round, and 7 of them are seasonals. We also have 9 different offices throughout the state, and that's where you will find our permanent staff located. There is a state level monitor advocate who monitors the state delivery of services to migrant and seasonal farm workers, ensuring that employment services to farm workers are provided qualitatively and quantitatively proportionate to those services provided to non-MSFWs. So impact, right? The impact that our staff, outreach staff makes, it's unbelievable. About more than 14,000 MSFWs are contacted annually, and that is made possible thanks to the outreach efforts of our outreach staff. They spend the majority of their workday out in the field, contacting and visiting MSFWs where they live, work, and gather. It's also important to mention that partnerships are key in everything that we do and the job that we do. Also, that work tools made accessible to our outreach staff. And again, like the meaningful connections, the collaboration with different partners makes it possible to move quickly to better serve our MSFW population. An example of a recent outreach event throughout the season, we are at different events in the community, but this one in particular on Sunday, July 30th, 3 of our staff members, myself, and our state monitor advocate, Mr. Gerardo Aranda, we were on site delivering employment and training information to MSFWs and their families at the Farm Worker Appreciation Day event in Grand. This is a well-established event that just keeps growing and growing every year. This year, about 300 families were reached, and families receive information from more than 15 different organizations, a bag of food items, backpacks, school supplies, shoes, books, toys, just to name some of the items that they received, and also a folder with employment and training information available to them. And then thereafter, we go on to the follow-ups, more like a one-on-one with our staff and then the MSFWs. So that's all the information that I have. Again, I thank you for your time, but I would like to leave you with the following saying, and that is to never stop looking for those little ways to serve your customers better. Thank you.
Thank you, Ruby. A question for you, Ruby. For this Farm Worker Appreciation Day, was that something that is that organized by your department, or is that organized by a community-based organization? Who's
Yeah, the main organizers are the Michigan, the Migrant Resource Council in that area, the Sparta MRC. So it's a group of different organizations that come together to make this a successful event.
Okay. So it was organized by the Resource Council, which for the audience, we'll talk about what the Resource Councils are. Dale will mention that in a little bit. But so it's organized by the government kind of council or committee, but some nonprofit organizations were there, community-based organizations.
Yes.
Were a part of it. Okay, good to know. And Joe, we might add, I want to ask you after we're done, I want to ask you about the Migrant Child Task Force event, but that can happen after. Well, thank you, Ruby, for your information. I will pass the mic now to Steve.
Thank you, Matt. Thank you, everyone, for being a part of this conversation. As Matt said, I'm Steve Wagstaff with the Michigan Department of Agriculture. I am one of 7 inspectors that are responsible for licensing migrant labor housing in the state. Our regulation requires a license when 5 or more migrant workers are housed on a parcel of land. So what do? We're really looking at the cleanliness and the safety of the housing. So that extends not only to the unit that people are living in, but also the area around the building. We're looking to prevent any kind of issues as far as safety, bad odors, anything that could impact the quality of life of the occupants. We do, as an agency, we have a huge breadth of things that we're looking at. The agency looks at animal health, it looks at plant disease issues, looks at even like that your gas pump is dispensing the amount that you're being charged for. So the migrant labor housing unit is just a small part of a big picture of what the agency does. So I've talked a little bit about the safety of the housing and the site. What else are we looking at? We're looking all the way down to the utilities that are provided to the building. So are they using propane? If so, is it being done in a safe manner? The heating systems, the electrical systems, everything. When it comes to water quality, we do a minimum of 1 well water sample prior to licensing each year. So we will not issue a license if the water sample has failed, unless there are some remedial techniques that can get us through for coliform issues. We're also assigning the maximum capacity of the units based on the size of the units. We're looking at where are the beds placed. So a minimum of 50 square foot per person per bed in the bedroom areas. We are also, a big thing we look at is fire safety. So every sleeping space needs to have 2 remote pathways of egress, one of which may be a compliant sized window. We're also looking at ventilation and natural light. So no habitable space of the building lacks natural light or ventilation. I already mentioned.
Steve, a question for you, Steve. How much of your work would you estimate is scheduled inspections of housing before it's occupied? And then how much of your work is responding to complaints or issues being raised kind of like throughout the season once they're already inhabited?
Right. So we have 2 big inspection types. We have a pre-licensing inspection and in-season inspections where we're checking in on licensed housing to make sure that it's being taken care of appropriately. So those 2 combined, I would probably put at about 70–80% of our duties. Complaints and enforcement and all of our other activities, such as plan review, would fall into the remainder. Yep. So here's an example of recent outreach that I performed. This is one, unfortunately, one of several this year where occupants were impacted by bed bugs. And so in those cases, I'll often go in and try to verify the complaint by searching the seams of a mattress. So in this case, it was verified, and the owner of the housing was immediately contacted and a corrective action plan set. So they did go ahead and contract with a licensed pest control company. And the result is that the occupants have stated that this is no longer impacting their quality of life.
Thank you, Steve. That's interesting. Well, we have a few questions for you, well, really for all the panelists, about what that follow-up looks like, and kind of thinking about how specifically someone like you, Steve, an inspector, might do outreach directly to the farm workers and follow up to make sure the bed bugs are gone, but then also how an outreach worker from the Health and Human Services Department like Joe, or people on Joe's team, and someone like you might coordinate. But thank you for the information, Steve. We're going to pass it to Dale now. And then after Dale's presentation, we're going to open it up to a discussion. So again, if people have questions or if people have comments or something, put those in the Q&A or and we'll get to them after Dale speaks.
Great, thank you, Matt. Appreciate it. So for the Interagency Migrant Services Committee, it's important to understand that it's a long-lived committee. It's been since the late 60s, early 70s that we were formed. Really coming out of a lot of changes that occurred in the state in reaction to the needs of migrant farm workers and a need to ensure that that valuable agricultural employee was being served. So starting in 1972, we had the IMSC start as a way to coordinate service delivery among especially among Michigan state departments. So, on this call, you have membership from MDHHS, Joe and myself, Leo with Ruby, and MDARD with Steve. There are other agencies that have roles in serving migrant populations, and that includes the Department of Civil Rights within our state, as well as the Department of Education. So those are kind of like the founding pieces, but there are so many more agencies that provide services to farm workers. We have educational institutions, both at Michigan State and University of Michigan, that are parts of this group, as well as those that are providing legal services and immigration services, as well as private agencies like Telemon, which provides Head Start and National Farm Worker Jobs Program services. Farm Bureau is a member as well, and we also have membership from a couple of the U.S. departments that have a desire and a need to serve farm workers in our area. So they've come together and they work together. We work together to resolve issues, surface issues, and resolve them on how we can better serve farm workers. Hi, Matt.
Hello. Yes, I figured it would be a good time to just stop the sharing. But Dale, I have a few questions for you
Sure.
about the history of this, and thinking about how other states might be trying to set up at the state level a statewide committee between the agencies. This was mandated by state law or by executive order from the governor of Michigan back in. Okay. And so that means that thinking about the funding of this, the funding is for each state agency to attend these and to pay for some of their staff time. That's mandated into the charter, if you will, of these different organizations who serve migrant seasonal workers in Michigan.
Right. There are certain folks within our IMSC who are required to have migrant service programs. And for example, Leo, which is the Department of Labor in the state, is required to provide migrant services as part of their Wagner-Peiser legal settlement. Our department requires that we have a migrant service program. And again, there's other agencies. So there may be, if you're in another state, there may be other agencies that provide services to farm workers, but you don't know who they are, or they're not in a formalized basis. It really does matter how the state leadership sees the need to protect farm workers, understands that they're essential workers, understands that they're an important part of that state's agriculture, and is the impetus behind not only having staff to do this, but recognizing that by working together, we're able to accomplish a lot more together than we can individually.
Okay. Well, a question about new members. And Dale, you've been in this capacity since 2014, right? Being the point person for the
Yes.
statewide committee. So in your time since in the last 9 years, has the committee grown? Have you all invited new members, maybe community-based organizations or something like that?
Absolutely. We've had new membership along the way. University or the UFW Foundation had sought membership, and we had bylaws that were put in place prior to my joining that described the purpose of what the committee was, as well as how we could have a vote to determine whether a new agency could join. And so that allowed us to bring in UFW Foundation. Really, if an agency serves farm workers on a statewide basis, they can petition for membership. And especially it's sometimes I get requests and I say, well, attend, 6 months worth of meetings and see if this is something that your agency wants and can contribute to, and then we can have a vote and bring you into this. Really, it works because we're all understanding that we have a shared mission and purpose, and we can incorporate additional agencies that share that mission and purpose. They don't have to be exactly the same mission, but we overlap enough that we see how we work better together.
Yeah. Well, one of the questions that we have from the Q&A box is asking about health immunizations. And that was one of the questions that we wanted to, or one of the themes that we wanted to talk about was especially COVID and how you all, at the statewide committee level, but then also at the various agencies, how you all organized COVID vaccines. So Joe, I'd like to ask you how your all's outreach from Department of Health and Human Services, what did the outreach for immunizations look like before and then during or after the pandemic? And then maybe also touch on any coordination that happened, like related to the vaccine outreach or events that you all do, and how other agencies might factor into that, maybe at housing sites or passing out labor materials.
Yeah, sure. That's a great question, Matt. And, to be really honest with you, we are the Department of Health and Human Services, but pre-COVID, we didn't really do a lot with the health component. We were really good about outreaching, providing farm workers with information regarding our, public assistance and other supportive services. But the COVID really brought out that need. So we had to pivot and look at ways to connect with farm workers. And this was, with testing. And then of course came the vaccination. Now, we did develop greater partnerships. Sometimes we talk a little bit about the silver lining and things. And, although COVID was a horrible, horrible time for many, there were some things, great partnerships that came out of COVID. So one example would be, we started working a lot more closely with migrant health centers and health departments. That came about from our, migrant work group committees that we had set up throughout the state. They were meeting really often during COVID, and then of course, continue to meet, now, and we actually are extending the services now, post COVID. So, really the way it looks is, working with those migrant health clinics, health departments. The key is getting the services to the farm workers, right? That's always been the success for our department, going to them where they're at, regardless of where they're at. So, those partnerships were, us working with the migrant health centers, the health departments, and then other agencies, taking the medical buses, taking nurses, medical staff, working together to get them vaccinated at the camp where they're at. So I think that was something that, wasn't happening prior. And thanks to, you know, just our collaboration and great partnerships with others, we were able to get connected to these services. Now, are we saying that, you know, now that COVID has, it's, you know, it's not over, but now that COVID has winded down, are we saying that that service has stopped? No. We've definitely, you know, noticed that there are some gaps in other types of immunizations, and that's something that we are continuing to work with our local health departments and also with the migrant health centers to ensure that our farm workers are getting the immunizations that they need.
And that collaboration, when you mention something like that, the local health departments, does that look like being on a monthly conference call between people in your specific county or specific area?
So we've actually changed the frequency of our meetings, but we are still meeting. Currently, we're meeting every other month with the work groups in the different areas of the state. And of course, the invitation's always open if there is a emergent need and we have to meet sooner than that. We are definitely, you know, ready to pivot. We've learned a lot from COVID, so we're prepared to pivot and meet as often as we need to. But yeah, currently we're meeting every other month, and then it's going to slow down a little bit during the off season, the non-peak season, which is like the winter months. But we'll be prepared to reconvene starting again next year.
Right. And we should clarify that the migrant work groups were, they were smaller committees at the county level or at the kind of regional level that were formed a few months into the pandemic.
I can
That's
provide
correct.
some information about that.
Yes, yeah.
The local health departments were, you know, really the front line of responding to the pandemic. And they, in Michigan, they're county-based. Sometimes they're just one county, sometimes they're a group of counties. But most of them did not have a migrant services component. And so they knew they had these people they had to serve, but they didn't really understand the population. And so the call was to provide a community work group anchored with the health department and the migrant health clinic and the agencies that are on this call, so that we could together work to meet the needs of, you know, the COVID-related needs of farm workers, ensuring that, you know, essential workers and the Michigan food supply was being guaranteed. That was what really brought us all together on this issue. Oh, Matt, you're on mute.
Thank you. Thank you for that explanation, Dale. Now I'm looking at some of the questions coming in from the Q&A, from the Q&A box. Thank you everybody for asking your questions. What federal agencies are a part of the committee?
So we have the Social Security Administration. We have the U.S. Department of Labor. We also have representation from the U.S. Department of Agriculture and Rural Development. Those are our primary partnerships. We do have some with civil rights as well as the Homeland Security.
Okay. Well, I'd like to bring in Ruby to ask you about what the same question I asked. I think it was Steve, was the percentage of your time spent responding to complaints. So maybe someone contacts a hotline reporting a labor violation or wage theft, versus how much of your team, you all in the outreach workers that you supervise, are responding to complaints or issues, and then how much of your time is spent just doing proactive outreach and visiting workers at their housing?
Yeah, for us, we are federally mandated to be 50% or higher of our time has to be spent out in the field, especially during peak season. And peak season for us starts mid-March and ends mid-November, depending on the weather. Then we go into the off season. But during the season, we are expected of, or staff expected to be out there in the field 50% or the majority of their time out in the field. A percentage regarding complaints, honestly, I would not know of a percentage of time. It's not something that, they receive on a daily basis, but when they do, they can either have them complete the form that we have to process. The ETA 8429 is a form that Department of Labor has given us access to, and that is the form that our staff are trained to help MSFWs complete. Or they can come into their Michigan Works offices to be assisted in taking a complaint, or if they want to remain anonymous, take it via an apparent violation. Always with the intent of also educating them, letting them know, right, especially when it comes to wages, that if it's determined that an investigation is going to have to take place, their name eventually has to be disclosed.
Okay, thank you.
Mhm.
And Steve, a question for you. We have quite a few questions in the Q&A about housing violations. Can you go over what are some of the common housing violations that you see with farm worker housing in Michigan?
Sure. The most frequent violations are going to be issues with window screens, occupant removal of smoke detector batteries, which I get. If they're annoying folks, it's your first response to take them out. Another one would be just the need to maintain the yard. The businesses get busy with their crops and sometimes need a reminder to get out there and mow and weed whip. Yeah, those would be the most common.
Okay. And how about with the recent issue this summer of the wildfire smoke? What were you all able to do? And was there any health component where you collaborated with Joe and her team about the health issues of wildfire smoke, but also the relating to the structure and airflow within the housing?
Yeah, so this is something we're having internal discussions on. Really, our code is set up in a way that never anticipated this issue in Michigan, and we're in need of updating that code. We are performing outreach to employers, sharing the Air Now government website that will have the PM 2.5 ratings for each individual area, and encouraging the use of PPE and being sensitive to the workers' needs there. I think ideally we would need a way to shut all the windows of the units and have central air, because we're in a hot portion of the year. And so that would be something I'd look forward to addressing. It'd be a good opportunity.
Okay. Well, I'd like to ask you all about a hypothetical situation where, and Steve, Ruby, Joe, Dale, anybody, feel free to chime in. But I'm wondering how, if let's say Steve goes to perform housing inspection where there are workers who are there, and the housing inspection is all good, the place is fine, but the workers maybe tell you that they're not getting paid and they have a labor complaint. How would you, Steve, then go about channeling that information to who it needs to get to? Is that something that you give to your supervisors and then they bring it to the statewide agency? Or do you have a personal contact or a direct line to Ruby or someone on her team to be able to phone this complaint in directly? Or what does that look like?
Right. It can play out a couple different ways, but in general, I would work together with my leadership to figure out a best referral there. It would likely be a referral to USDOL Wage and Hour Division. There might also be other referrals that go out. For example, if maybe they are not subject to MISPA, or they would also need to not be under an H-2A contract, then the U.S. Department of Labor Wage and Hour Division likely wouldn't have authority. I know some of those people are on the call today, so maybe they could chime in the chat if they want to clarify. But in that case, it would probably be a referral to one of the advocate law firms in the state of Michigan, or the state it'd be Leo in that case. So Leo does have a wage and hour division, and they may be able to address it.
Yeah. So for us, Matt, we don't enforce anything, right? We don't have power over enforcing anything. So what we would do is assist the farm worker in taking a complaint with as much information as possible, processing that, and then sending it to our complaint coordinator. And from there, depending on the situation, it will be referred to the enforcement agency.
Okay, good to know. And Ruby, actually, while you're here spotlighted, we have a question specifically for you regarding the employment and training services. Can you share a little bit more of the type of job training you provide and what the goal is? Is it to help find other jobs in agriculture? Is it to move sectors to?
So overall, we want to see our farm workers working, but the goal is for our MSFWs to benefit from other jobs where they can make, more than minimum wage, have holidays off, don't have to work weekends. So, offering them the whole employment, the whole array of services means referring them to other jobs, whether it's an ag or non-ag, and then also letting them know about training opportunities for them and their family members that are available at their local one-stop service centers. So it's just providing information. If they're employed, wonderful. That's what we want to see, that they're working. But if they're not working, connecting them to other jobs. And if it's something outside of agriculture, not that we want to take people out of agriculture, but we definitely want them to better their lives and that of their families as well.
Okay. Well, good to know. Well, for all the speakers, but I might target this question at Dale. We're getting a lot of questions about H-2A and how H-2A workers access services, what the breakdown is in Michigan between H-2A workers and undocumented workers or other sorts. Do you have those rough numbers off the top of your head, Dale?
Yeah, I would have to defer to Ruby on H-2A numbers because we don't have direct involvement with the H-2A program like Leo does.
Ruby, can you speak to that at all? About the rough breakdown of how many farm workers in Michigan are H-2A versus how many are?
No, myself, I would not have that information. I'm sorry. And within our department, we have two separate units. One is the Agriculture Employment Services unit, and then our sister unit, which is the Foreign Labor Services unit. But I'm not, with that information, I don't have that. I mean, that's outside of my scope.
But it would be safe to say.
Go ahead.
Would it be safe to say that the H-2A program has grown a lot over the last 10 years, just like every other part of the country?
Certainly. And every year it just keeps growing and growing and growing more and more.
And are there considerations, Dale, from the state agency level and from that committee kind of perspective, is that H-2A workers, do they have a different path to accessing some of these services? Is there a different strategy that you all take trying to adapt rather to the influx of H-2A workers and their different demographics?
Well, they do tend to be eligible for less services from our department than domestic farm workers. For general purposes, our food assistance, Medicaid, and childcare services, our full services are for U.S. citizens and long-term permanent residents. There is an emergency services only Medicaid program that exists for undocumented immigrants, H-2A workers, and anyone. I mean, tourists coming in could, if they had an emergency hospitalization, could apply for emergency services only Medicaid. Often what we find with undocumented immigrants who live in this country is that one or more parents is undocumented, whereas one or more children are U.S. citizens. And so we can provide benefits for those citizens in their family, including, we'll have situations where the children need childcare and they're U.S. citizens, but the parents are undocumented. It doesn't matter. What matters is that the children are citizens because they're the ones receiving the benefit of childcare. We also, I should say, we provide outreach services to farm workers of all types. We don't, ask first, what your immigration status is before we provide outreach services. When it comes to doing an application for particular benefits, that's when we get into the nitty-gritty of what their immigration status is. But we can make referrals to other agencies, even if they're not documented.
Okay. Well, we're nearing the end of our time, but one question that I think a few people asked in the chat related to the employers and the industry, and this question could be targeted maybe to Joe or to Steve, I would imagine, but any of the speakers, any thoughts or tips or what your experiences have been working with employers, going to housing sites, whether it be H2A housing sites or other, if it's employer provided, and managing the relationships with employers of who might not want you to be there because they might be trying to hide something, or they just have these attitudes towards you all.
For us at Leo, if I may, we have a dual customer service, and that is serving MSFWs and also agricultural employers. So for us, part of training and everything that we instill in our staff is always, as a best practice, is to make contact with employers prior to visiting the camps. Not everyone is receptive, it all depends also the time of the year. They're under a lot of stress too during the season. And if it's a no, we'll take a no for an answer, and they just keep trying, to make those connections as well. But we serve as a dual customer service for us in our agency.
Yeah, and from our angle, we do have a statutory right to visit any migrant labor housing that is housing 5 or more workers during reasonable hours. And if we're denied entry, which has not happened to me in 10 years, we would likely involve the state police, depending on what the need is there. When you look at relationships, I think that's one area where I do benefit from an annual licensing protocol. So I've gotten to know a lot of these housing providers, and I can working with certain personality types can be a little difficult, and also the finances on the farm are a big thing as well. We do have several dairy farms that license their housing in the state, and we know the milk industry is in a horrible financial situation. So being aware of those things, I think suicide rates are extremely high in that industry. So just knowing the full picture before you step on site, knowing who you're dealing with is something that I have with 95% of the licensees.
Right. Yeah, it's important to consider that big picture thing. Well, I know we have questions still on the table for all of our speakers, but I want to just to wind down here for the audience. Here is emails for the speakers. If audience members want to contact any of the speakers directly with questions, please feel free. I asked them ahead of time if they're okay with their emails being shared. They said they are. So I'll give people 5 seconds to write down these emails, and then we have an evaluation of this webinar that we'd love for all the audience members to fill out to let us know how we did and what you learned and everything. All right, I'm gonna move on to the evaluation, and I think the link will be shared in the chat as well. You can scan this code with your phone camera, or also I think my colleague should be dropping the link in the chat for the survey. And thank you all for being here. And here are some of the NCFH's resources that we have. Like I mentioned at the beginning, all these different things that we do. And yeah, please feel free to reach out to the speakers or to me directly for questions, or we'd love to hear about coalitions that are formed, how communication styles are navigated among different coalitions, whether that looks like monthly Zoom meetings between everybody or whether that's more personal connections. I think what we've seen with these Michigan speakers, that there's a little bit of both. Between someone like Steve and someone like Joe, they are on the same webinars every other month, but they can also contact each other's departments more directly if there's a more pressing issue. And thank you all so much.